Today, we thank all nurses all around the world, saving lives and giving of themselves. Here is a bit of wisdom for your day. Right now, governments worldwide are looking to shrink their healthcare budgets by pulling funding from the front lines. They are doing this while facing a global shortage of 5.8 million nurses, stretching an already exhausted workforce to its limit. To fill the gap, hospital systems often turn to unsafe labor substitution. Instead of hiring highly educated, registered professional nurses, they replace them with lower-paid, unregulated healthcare assistants. While a lower hourly wage looks favorable on a spreadsheet, stripping specialized clinical judgment from the patient's bedside drives systemic costs up. Patients experience more preventable medical errors and longer hospital stays, which transfers costs back to health budgets. The direct cost of treating patients harmed during care accounts for 13% of health spending globally. That translates to $606 billion drained from the economy every single year. Squeezing the largest segment of the healthcare workforce does not save money. It weakens the structural integrity of the entire global health system. If we treat nursing as a high-yield economic investment, the fiscal math changes. Closing the global health workforce gap and properly equipping these professionals would add $1.1 trillion to the global economy by 2030. That same investment prevents 189 million years of life loss to early death and disability. 7 specific, measurable mechanisms, the 7 powers, translate nursing care into this trillion-dollar value. Investing in nursing provides a specific pathway for governments to defend fiscal sustainability while meeting rising health demands. The first power is trust, a measurable driver of clinical effectiveness. In Lebanon, health ministries relied on nurse-led clinics to rebuild childhood immunization rates. Because communities trust these professionals, hesitant parents agree to vaccinations they might otherwise reject. Over the past 50 years, nurse-driven vaccination programs have saved 154 million lives globally. The second power is professionalism. This is the rigorous, science-based clinical education that turns empathy into life-saving action. A professional nurse acts as a system's primary safety net, anticipating complications before they become critical. For every 10% increase in bachelor's degree-prepared nurses in a hospital, patient mortality drops by 7%. Without the public's trust to ensure compliance and professional competence to catch fatal errors, the broader public health apparatus fails to deliver outcomes. Combining the reach of 30 million nurses with integrated care models allows health systems to expand universal health coverage into underserved neighborhoods, reaching populations before they require acute intervention. This infographic details these clinical powers. In the Power of Practice section, data shows empowered nurses can independently provide 77% of preventive care and use that same clinical authority to manage 47% of chronic care. Treating chronic conditions like diabetes and hypertension locally keeps populations productive and reduces the pressure on the most expensive ICU beds in the system. Scaling these capabilities converts a reactive, loaded hospital structure into a proactive, economically efficient health infrastructure. The power of proximity comes from time. Because nurses spend the most continuous, direct hours with patients, they operate as the system's early warning radar, detecting clinical deterioration hours before a crisis hits. In French Guiana, mobile nurse-led teams are navigating canoes down remote Amazonian rivers to bring advanced medical outreach and epidemic response to isolated communities. This ability to reach the most vulnerable ties directly into the power of peace. By maintaining care when infrastructure collapses, nurses provide an essential defense layer for global health security. Every single dollar invested in health yields an economic return of $2 to $4. To realize those returns, policymakers must modernize clinical workflows. By reducing administrative load and duplicate data entry, hospitals can direct highly valuable nursing time back to patient care. Systems must also enact safe staffing legislation calculated by patient acuity, the actual severity of illnesses, rather than relying on static headcount ratios. Providing this kind of structural enablement is what translates the theoretical return on investment of nursing into tangible global economic growth. Governments and global institutions must structurally empower nurse leaders, placing them at the highest levels of national and global health decision-making. Empowered nurses stabilize fragile communities, strengthen national economies, and provide the clinical foundation for global health security. Highly skilled nursing care is the indispensable foundation of global prosperity and health security. This has been Wisdom for Your Day. Subscribe, like, follow, and share. Knowledge is power.